How to treat sunstroke. Sunstroke is a serious condition and should not be taken lightly. Sunstroke is a type of heatstroke caused by sun exposure. It happens if the body is exposed to hot temperatures for prolonged periods of time, causing body temperature to rise to 105 degrees Fahrenheit or higher. A cardinal feature of heatstroke is confusion, so you cannot always work out that you have it on your own, and it can be fatal. If you suspect someone has sunstroke, seeking immediate medical help is essential for their safety. If someone suffers from a heatstroke long enough, there are serious repercussions, including possible death. If at all possible, get medical attention right away. Helping someone with sunstroke. Call emergency services. Depending on the symptoms and the person, you may wish to call your primary care physician or 911. Pay close attention to symptoms. Prolonged heatstroke damages the brain, causing anxiety, confusion, seizures, headache, dizziness, lightheadedness, hallucinations, coordination problems, unconsciousness, and restlessness. Signs of shock: X, bluish lips and fingernails, confusion, loss of consciousness. A temperature over 102 F (38.9 C), rapid breathing and/or pulse. Weak heartbeat, lethargy, nausea, vomiting, and dark urine. In some cases, they may be collapsed, agitated, or even in cardiac arrest, so take care and start CPR if necessary. Seizures. If the person is having seizures, clear the area for the patient's safety. If you can, place a pillow under his head so it does not bang on the ground during the convulsions. 4. If milder symptoms persist for an extended time, longer than an hour, make the call. 5. Avoid medications. Our first instinct is to take medicine when we don't feel good. If someone is suffering from sunstroke, certain medications will only make the situation worse. Don't use medications for fever like aspirin or acetaminophen. These can be harmful during a heat stroke because they may increase bleeding, which can be a very serious issue with blistered sunburns. Medications for a fever work well on someone with an infection, not on someone with heat stroke. Don't give the person anything by mouth if he is vomiting or unconscious. Anything that enters the person's mouth could become a choking hazard. 7. Cool the person down. While you wait for emergency services, get the person to a shady, cool, preferably air-conditioned area. Remove all clothing and get the person into a cool bath, shower, stream, or pond if possible. Avoid very cold temperatures. The same goes for using ice, which may also mask the signs of a slow heartbeat and cardiac arrest. Help the person remove any extra clothing, hat, shoes, socks to aid in the cooling process. Do not rub the person's body with alcohol. This is an old wives' tale. Alcohol cools the body too quickly, which can result in a dangerous temperature fluctuation. Rub the person's body with cool water, never alcohol. 10. Replenish fluids and electrolytes. Have the person sip either Gatorade or salty water, 1 teaspoon salt per quart water, to counteract both dehydration and the loss of salts through sweating. Don't allow him to drink quickly, which can induce shock. If you don't have any salt or Gatorade, plain water will help also. Alternatively, you can administer salt tablets. Doing so can help balance electrolytes. Follow the instructions on the bottle. 12. Help the person stay calm. When the patient stays calm, the patient can help. Massage the person's muscles. Massage gently. Your goal is to increase the circulation in the muscles. 14. Muscle cramps are one of the early symptoms of sunstroke. Usually the calf areas are most affected. 15. Lay the person down. One of the most prominent effects of sunstroke is fainting. Protect against fainting by laying the person down. If the person does faint, turn him onto his left side with his right leg bent for stabilization. This position is called the recovery position. 16. Check the person's mouth for vomit, so they do not choke. The left side is the best side for blood flow because our hearts are on that side. 17.